When I went in for my first baby, I had kind of bought into the narrative that I would just go along with what my provider said and that things would be unicorns and rainbows after the baby was born. That's sort of what I was taught in my birth class. Honestly, not a horrible strategy because I was not prepared to make choices for myself at all. And I just sort of sailed to the hospital, blissfully thinking that once baby was here, all would be well. Now, I went home to my own personal nightmare. I had torn a lot with my forceps birth, and I also had a good dose of raging postpartum anxiety, which, by the way, was not talked about at all back then. And I had no idea how to take care of myself. In fact, I was taking stool softeners that did not even work, and I really wanted that epidural a week later when I had that birth in my bathroom. The thing is, I was not prepared at all to make choices for myself. Pregnancy, birth, postpartum, none of them. And I did not have realistic birth or postpartum expectations. And honestly, even laboring at home really freaked me out because I was so reliant on the hospital staff to take care of me. A year later, I actually became a labor and delivery nurse, and I loved sitting at the bedside, explaining to patients how they could engage more in their care and have realistic expectations for their birth and postpartum life. Fast forward 15 years, and I realized I wasn't making as big of a difference as I wanted one-on-one, and so I brought my brand of making choices for yourself and creating realistic expectations online. Here at The Pregnancy Nurse, we prioritize 3 things. Number 1, making choices for yourself based on your provider's expert advice and what's important to you. Grab my free birth preferences sheet down below. It's going to be so helpful for you. Number 2, evidence-based recommendations to make pregnancy and postpartum easier and safer. The Pregnancy Nurse is full of those. Number 3, helping you get prepared for your upcoming hospital birth. You've got 9 months to prepare, and it is going to pay off big time. I've got a birth course, which is actually the key to number 3, but grab that birth preferences check sheet. I actually have a secret video on how to make birth plans that really work for you, so I will see you in there. Welcome to The Pregnancy Nurse.